All right, let's talk about something so many of us have felt, that annoying, persistent ache deep in the lower left side of the back. Today, we're going to dive into what's really going on back there. You know the feeling, right? Maybe it creeps up after a long day sitting at your desk, or maybe it just hits you out of the blue. You're just trying to live your life and bam, there it is. That one specific spot that just won't let you forget it's there. Well, if that sounds familiar, I want you to know you are definitely not alone. This is one of the most common complaints doctors hear about, and it affects people of all ages, whether you're an athlete or a desk jockey. So, what is actually causing this super specific pain? Well, the truth is the lower left side of your back it's like a really busy intersection in your body. There's a lot going on, which can make figuring out the exact cause a little tricky. And when I say it's a complex neighborhood, I'm not kidding. You've got your lumbar vertebrae, the bones that give you structure. You have all the muscles and ligaments wrapping around them for movement. You've got the super important SI joint where your spine connects to your pelvis. Plus, you have major nerves running through and even organs like your left kidney hanging out nearby. Pain can literally come from any of these things. But here's the good news. Even with all that complexity, most of the time, the vast majority of the time, that lower left back pain really just boils down to a problem with the muscles and skeleton. Specifically, it's usually one of these three main culprits. So the top offenders are, number one, a simple muscle strain. You lifted something funny or just overdid it. Number two is SI joint dysfunction, which is basically inflammation right at that critical junction between the spine and pelvis. And number three, issues with the lumbar disc, like a bulge that's pushing on a nearby nerve. Okay, so now let's play detective. The best way to start figuring this out is to learn how to listen to your body, because the type of pain you feel is giving you some massive clues about where it's coming from. Let's decode those signals. This is the big question, isn't it? The one that can keep you up at night. Is this just a pulled muscle that's going to go away, or is my body trying to tell me something way more serious is going on, maybe with an organ? So here's a huge clue. Your typical muscle or joint pain usually changes with your activity. It gets angry when you move a certain way, and it often feels better if you rest or change positions. But that potential red flag, organ-related pain, it often doesn't care what you do. It's just there, constant and deep, and it might bring friends along like nausea or a fever. Okay, let's add a twist. What happens when that pain doesn't stay put in your back? What if it decides to go on a little road trip, traveling down into your hip or even down your leg? That traveling pain is a classic textbook sign that a nerve is getting irritated. Something, whether it's that angry SI joint, a bulging disc, or even a super tight muscle, is basically pinching or poking a nerve, and the pain you feel is just tracing that nerve's highway. Understanding what might be causing the pain is half the battle, but understanding when and why it flares up, that's where you can find some really revealing patterns. Let's look at a couple of the most common triggers. I hear this from people all the time. Sitting is the absolute worst. It seems weird, right? You're resting, so it should feel better. But there is a very clear mechanical reason that sitting can be a total back pain machine. It's basically a domino effect. First, when you sit for a long time, you're putting constant pressure on your lumbar discs. Second, the muscles on the front of your hips, your hip flexors, get short and tight. Third, those tight muscles start to pull your whole pelvis forward, tilting it out of alignment. And finally, that tilt puts a ton of extra strain right on the muscles and joints of your lower back. It's a perfect storm, all from just sitting in a chair. And what about pain that wakes you up at night? That's the worst. This can often point to inflammation, which just feels louder when everything else is quiet and you're not distracted. Or it could just be that the way you're sleeping is putting extra pressure on a sensitive disc. This right here is some of the best advice you can get. Become a detective of your own pain. Just jotting down notes on your phone, when it's bad, what makes it better, what it feels like, is incredibly useful. When you walk into a professional's office with that data, you're giving them a treasure map to help figure things out way faster. Okay, we've done the detective work. We've looked at the what and the why. Now for the most important part. What on earth do you do about it? Let's talk about finding that path to relief. Now, for a simple, straightforward muscle spasm, say you just tweaked it doing some yard work or moving a box, you can usually expect that to calm down on its own within about 3 to 7 days. A little rest, some gentle movement, and it should resolve. And this is a really big but. If that pain keeps coming back, or if it's just sticking around for longer than a week or two, That's not just pain anymore. That is a signal. Your body is waving a big red flag trying to tell you that there's a deeper, underlying issue that needs to be properly addressed. Please don't ignore that signal. And this right here, this is your official when to call a professional checklist. If your pain has been hanging around for a few weeks and isn't getting better, or if you have any of these other symptoms, especially stuff like numbness, tingling, or weakness in your leg, or changes in bladder function, it's time to stop guessing and get a real professional opinion. Because at the end of the day, you can't fix a problem if you don't actually know what the problem is. Trying to treat your back pain without a clear diagnosis is just like throwing darts in the dark. Getting that professional assessment is the absolute key that unlocks an effective treatment plan. And the really great news is that once you have that diagnosis, there are so many effective evidence-based treatments out there. Things like chiropractic adjustments to restore motion, specific physiotherapy exercises to build strength, spinal decompression. There are a lot of fantastic tools in the toolbox to get you on the road to relief. So we'll leave you with this final thought. Just take a second right now and ask yourself, what is my pain trying to tell me? Is it telling me to change the way I sit, to get up and stretch more often? Or maybe, is it telling me that it's finally time to get a professional diagnosis? Listening to that signal is always the best first step. Thanks for joining us.